Medical Notepad, brought to you by Cardiovascular Systems Incorporated's Patient Advocacy Campaign, Take a Stand Against Amputation, and The Way to My Heart.
This is George Adams, interventional cardiologist with this week's Medical Notepad. Today we're going to be discussing the new drug-eluting balloons that are hitting the market in the United States. They're actually under trial investigation. These are balloons that allow us to treat the periphery as well as coronary vasculature in terms of leaving no scaffold behind, no stent behind. These stents are metallic scaffolds that prop the vessel open, but over time can lead to an enraged or increased inflammatory response that causes it to reblock over time. By using these new drug-eluting balloons that have limus attached to it, we are able to treat the vessel without having to leave a metallic scaffold. What's interesting about this new technology is that these balloons actually have a cell adhesion or What's interesting about these drug-eluting balloons is that they have these microreservoirs that have this anti-neoproliferative, this anti-inflammatory agent, the sirolimus, that is attached to this, what we call excipient, that allows it to attach to the vessel wall and elute over time, very similar to one of these drug-eluting stents that's been used in the past. And what's so exciting about this is that the preliminary data is very encouraging, that we have similar outcomes to the current strategies below the knee with plain old balloon angioplasty, similar data, preliminary data above the knee that can compete with the current strategies to treat blockages from the hip to the knee joint. And then almost more importantly, in the heart, these blockages that form over time in the heart, rather than using a stent for some of these lesions, we can use a drug-eluting balloon to get similar outcomes. For this week's Medical Notepad, this is Dr. George Adams.
Remember, the advice and views offered during this series are for informational and educational purposes only. Always ask your own healthcare provider for explicit consent before acting on any information provided here. If you want more information on peripheral artery disease, go to standagainsamputation.com. And for real-time support, go to thewaytomyheart.org.